So the dental implant process,
Yeah.
the two main categories, I guess you have certain people, they still have their teeth,
Yep.
but it's been determined they have to be removed and they don't want dentures.
Right.
Or the people that are currently wearing dentures. So
Yeah.
if they go to your practice, what can they expect? What's that process?
So it's 3 simple steps. Whether or not you have teeth that are bad that need to come out, or if you have a denture that you can't wear that you need to replace, 3 simple, easy steps. First step is a consultation. We evaluate the bone, we make sure that you're healthy enough to go through the process, and the second step is designing the teeth that you need that meet your criteria as far as the size, the color, the shape. We do all that in-house. It takes us just minutes to be able to design a smile.
You show them what they're going to look like ahead of time,
absolutely.
is that right?
It's incredible. And imagine someone who's never seen straight, healthy teeth in their mouth before. So the third step is the surgery. It can actually be the same day as their consultation. And we're able to have them go to sleep, numb them up, teeth out, implants in. They wake up that same day with teeth for the first time in their life, that they're showing off, that they can chew, they can eat, they can do things that they've never been able to do before.
So the morning of the procedure, they could come in, get their teeth removed.
Yeah.
And then you place the implants, give them the new teeth, and they can walk out that day
Unbelievable.
Is that unusual? Or
Well,
that's
you know,
common in your practice?
In our office, it's the standard way we do things. In other years ago, it used to take lots of time. And you know, that quote unquote is the traditional, what's called the analog way to do things. Well, we've got the digital technology.
Okay.
We've got robotic guidance. We are able to do things in office that have never been possible before. I mean, oh my gosh, it's incredible.
Now, you have a thing called the SmolerXpress. I guess if you're currently wearing a denture, it's even faster.
Oh my gosh, you know.
Elaborate on that. How does that work?
It's life-altering. Patients with dentures, more precision, no incisions. Can you imagine that there's no cutting of the gum? There's no stitches. And we're able to take that patient with dentures. And the SmolerXpress is a way to make dentures obsolete. Implants go in, teeth are made on top of them. You could come in over lunch and leave with teeth for dinner.
We were on the phone one day and you said there was a patient that came in this morning.
Yeah.
And by noon,
they're
they
getting
have
their
new
teeth.
upper and lower teeth that don't come out.
And no bleeding of the gum, no incisions. I mean, it's taken us a while to kind of perfect the process. It's proprietary, so I'm only aware of one SmolerXpress in the country. I mean, globally, it's unbelievable.